is it good that people will not have their prescription drugs seized?
Well, let's talk about if it's good. We passed the Medicare Part D so that we could ensure that seniors don't have to choose between food and drugs. That was enormously important. It was overly complicated, and they've revised it a number of times. But now the seniors, and I have one of the most senior districts in the country, over 65, and so consequently, we've heard time and again how they're saving thousands of dollars, how it's working well for them. The competition drives down the cost of drugs. And when I ran for office, I promised that I would fight for a prescription drug plan, because if you were to conceive Medicare today, you would have to have prescription drugs in it. You couldn't exclude that because people are so much more dependent on it than years ago when it was created, not only for their quality of life, but their life altogether. So yes, I think it's very important that we had that drug plan. Secondly, I stated from the beginning that reimportation of drugs was a critical issue and something I supported as long as we could guarantee the veracity of those drugs.
Well,
one of the
original
bills that was envisioned would allow drug companies to reimport even from areas in Africa who could only guarantee 30% of the accuracy of their drugs. And so that's been my biggest concern. Reimportation, lowering costs, I'm fine with that as long as we can make certain that our seniors or those who need these drugs for their very survival are getting what they paid for.
And that's the question. Are they getting quality prescription drugs from Canada right now?
Well, what happens if they are incurring that risk on a very small scale? They're choosing to take that risk themselves. It gravely concerns me. What concerned me in the bill that I did not support in the House of Representatives and the Senate would be to allow a massive reimportation, meaning that our drug stores would actually be reimporting as well, so that they couldn't guarantee the veracity of their drugs either on that massive scale. When individuals are going to reimport on their own, they're taking that risk. I have concerns because it's very easy to replicate these drugs, and there are enormous consequences that go with that, but sometimes if individuals choose to reimport, even though we've driven the cost of drugs down, even though with Medicare Part D we've drastically reduced the cost of their plans, but if they choose to make that risk, then I think that risk is theirs.